It's around 1 p.m. We are at Terrasse du Frein in the Haut Quebec. And as you can see, like thousands of frontline workers are there to protest against the mandatory vaccine that was supposed to be in on the 15th of October. But Christian Dubé decided to postpone for the 15th of November. I don't know what will change, but it's a fact. This protest will have a march until like the Abraham Field, so we'll follow it.
The government has already extended the Jabs for Jobs deadline by a month, but I don't think any of these people will be changing their minds come November 15th. So how do you think this is going to play out in the weeks ahead?
So Christian Dubé is our health minister, is the one who took the decision about it. It's actually him who took the decision. So he got the support from François Legault. But he say we will postpone the date to the 15th of November, but we are not sure when it will be the 15th of November, what will be the case. If they will like obligate, like mandatory it, do we will postpone it or just cancel it? They are not sure yet because they don't know what will be the situation in a month. So imagine now we have 27,000 health workers that is not fully vaccinated. So it's 27,000 people who are stressed and don't know what will happen on the 15th of November.
Yeah, well, you know, and that's the thing, Alexa. The 15th of November, that's barely 3 weeks away. I don't see any of those people, given their passion in that protest, changing their mind, doing a 180, saying, yeah, you're right, you convinced me, I'm going to get vaxxed. So given that the number is so huge, 27,000, well, let's put it this way. If the government of Quebec was serious about this threat and on November 15th said to those 27,000 people, you're fired or you're suspended without pay, however you want to call it, what would that do to the frontline situation in Quebec?
So the thing is, in Quebec right now, they are trying to get like people from other country, like Colombia, or to come to work as a health worker right now. The thing is, they don't have staff anywhere in the around the world right now. So I don't know how they will be able to do it. And right now, they are telling that people who have, I don't know if you know about it, but the health worker, like nurse, they will lose their license too. When they will get fired, they will lose their license to practice. And because they refuse to take the vaccine, they will not touch the prime. Like they offer like money for the nurse to come back to work and to keep the overtime obligatory, like overtime working. So right now they say, oh, but you didn't take the vaccine, so you cannot touch this prime.
You know, Alexa, I really don't understand what's going on here. If we go back several months ago, before there was such a thing as a COVID-19 vaccine, these frontline workers, these nurses and other healthcare workers, they were championed. They were the healthcare heroes. Remember that?
Yes.
And now that there is a vaccine, well, the situation is no different in the hospital. They're being demanded to take it, or else you're not a hero, you're a zero. I just can't get my mind around this. If we're allegedly still in this pandemic, don't we need as many experienced healthcare workers as possible? This would be the worst time, I would argue, to start firing them.
Yeah, and actually, so they prefer to fire really good staff and to hire novice people. So you prefer like what? Like people who doesn't know how to do their job for take care of us to keep like a really good staff who have already have 3 PCR tests a week, and most of them didn't got the COVID, or if they did, it's only vax or it's nothing. It's really drastic, just like.
So, Alexa, what do you think is really going on here? Since the science doesn't make sense, is this all about tyranny on the behalf of the Legault government? They kind of like, the kind of totalitarianism they've enjoyed for the last year and a half, and now they're doubling down on it, making demands that, quite frankly, I think are going to make Quebec a worse place to live in if they fire all these 27,000 workers.
So actually, Legault, since he started to be like you call it a premier, we call it prime minister here. I think he just loved the power that he got from the health emergency, and now he promised all the time to people, but he's always lie, and people still believe that he's doing that for good, but he's not. And if our health system collapse, I'm not giving like much from us, because our reputation for our health system is supposed to be one of the best in North America and in America actually. And now it would be like the worst, and everybody will like see their surgery postponed, all the treatment postponed. A lot of people will die because they are not the treatment. So I don't know what's going on here.
Hey folks, that was an excerpt from my show, Rebel Roundup. Now, to get the full meal deal, why not go to Rebel News Plus, sign up, and never miss a Rebel News Plus show in the future.